Habari, hello, and greetings from Seattle. I wish that I could join you all in person, but am honored to be invited to send this message. Asante Sana, many thanks for this opportunity to greet and welcome you all to the 2020 annual review meeting of the University of Nairobi STD HIV SRH Collaborative Research Group, as we celebrate the 40th anniversary of the collaboration, which was established in 1980 between the University of Nairobi and the University of Manitoba in Canada. To prepare for this welcome message, I reread the book, Piecing the Puzzle, The Genesis of AIDS Research in Africa by Larry Kratz. And for those of you who want to dive a bit deeper into the early days of AIDS research in Kenya in particular, and the early years of the collaboration between the University of Nairobi and the University of Manitoba and the University of Washington, I highly recommend this book. It's currently available from the University of Manitoba Press. I was lucky enough to meet the Canadians Alan Ronald and Bob Brunham at the University of Washington in Seattle after completing my own service in the Medical Corps for the Navy during the Vietnam War. I came to the University of Washington and was in my residency in internal medicine when Alan Ronald was studying microbiology at the UW, and Bob Brunham soon after subsequently also came to the UW and became one of my first postdoctoral fellows in infectious disease. In 1985, when Alan invited me to come to Kenya and get involved, and I can say that was truly the beginning of my global health career. From the early days of collaboration and research in Kenya, I expanded my focus to collaborate with Makerere University in Uganda and directed the Infectious Disease Institute there, the IDI. Over the years, I participated in partnerships early in the HIV epidemic in many other African countries, as well as in Peru, the Caribbean, India, and Southeast Asia. And the development of ITEC at the University of Washington, International Training and Education Center for Health, supported our HIV/AIDS prevention and treatment programs in countries throughout the world. In terms of this collaboration with the University of Washington, our University of Manitoba and Kenyan colleagues have been unfailingly gracious and collegial. I remember one occasion that typified our cordial relationships that occurred after the University of Washington had joined the collaboration with the universities of Nairobi and Manitoba. We were attending meetings at the University of Manitoba where we were treated to a dinner for all of the 25 collaborators. Every place setting had a place card marked with the first and last name of the guest. For example, Alan Ronald, Frank Plummer, Bob Brunham, etc., except for my card, which was marked simply Holmes. And when the waiter came around, I asked why my place card only said Holmes, while everyone else at the table had their full names on their place cards. And the waiter looked at me, and he responded politely and with great respect. It is the policy of the University of Manitoba not to use official titles on our place cards. And the fact is, they have treated me like a king from day one, even though the university policy resulted in my being called Holmes, not King Holmes, quite frequently from then on. So back in Kenya, what was originally planned to be a collaboration on the control of all STDs transitioned to focus primarily on HIV/AIDS. Frank Plummer, Joan Kreis, and Peter Piot, along with Dr. Nzanzi, and other collaborators at the University of Nairobi, increasingly focused on HIV/AIDS research and brought the AIDS story in Africa onto the global stage. My mentee, Joan Kreis in particular, was instrumental in persuading us to focus on HIV and AIDS in Kenya. Frank and I initially wanted her to study gonorrhea with us, but she was determined to focus on HIV/AIDS. And I think the smartest thing I ever did was to support her. She was the first author for the 1986 New England Journal of Medicine article, AIDS Virus Infection in Nairobi Prostitutes, Spread of the Epidemic to East Africa, which quickly helped to put the hitherto little-known AIDS epidemic in Africa front and center in the global limelight. At that time, most governments in Africa were unaware or in denial about the growing AIDS epidemic. So our findings were met with both political and scientific blowback at first. The New England Journal of Medicine article was a watershed publication, however, and ultimately led to further funded research, which in its turn resulted in key breakthrough technologies to combat and control the spread of HIV/AIDS worldwide. I would like to acknowledge how essential this collaboration has been for our University of Washington and for the UW Department of Global Health especially, and for our faculty and students. I would particularly like to recognize our many colleagues from Kenya and other countries who have come to the UW to help us with further mentoring, training, and program implementation. For example, Elizabeth Bukusi, who trained and received her doctorate at the UW, and who I believe was the second female scientist to be elected to the African Academies of Science a few years ago, and now collaborates with UW, University of California, San Francisco, and the Kenyan Institutes. At last year's conference of the Consortium of Universities for Global Health, the CUGH, I was asked by the chair of the session on mentoring why so many of the African and South American conference attendees have been trained by faculty at the University of Washington. And my response today would be that it was because the collaboration of the University of Manitoba, the University of Nairobi, and the University of Washington laid a solid foundation for the involvement of the University of Washington in cutting-edge research of HIV/AIDS treatment and prevention. And many of our UW faculty have benefited greatly in mentoring Kenyan trainees who are doing great work today. For example, Grace John Stewart, who many of you know, has trained over 50 Kenyan trainees so far, and many more have been trained and mentored here by other UW faculty, including Carrie Farquhar with our Fogarty Center and the Afya Bora programs, Scott McClelland with his STD research, Joe Zunt and Susan Graham with their NIH grants, and last but not least, Connie Kellum and Jared Baton with the important PrEP research that they've done with the folks here. Julie Overbaugh with laboratory research, Craig Cohen now at the University of California, San Francisco, our UW-UCSF iTech program with Nancy Putkammer, Gabrielle O'Malley, George Owiso, and myself. As a representative for the University of Washington, I am humbled and grateful for everything that we have accomplished so far together. Taking part in training the future researchers and public health leaders of Kenya is a privilege. That our collaborations would create such a dynamic, diverse, and distinguished network of long-lasting and productive relationships spanning 40 years is more than we could have hoped for. There are so many more who should be named as well, and my apologies for not being able to highlight all of you. I do look forward to many more years of our continued associations and to the discoveries and breakthroughs that our relationships will make possible. Karibu Sana, welcome to the meeting.